How many of us have seen the shows and seen the movies and dramas where somebody gets into an accident and they scream, "I need a doctor, I need a doctor"? Well, I'm here to tell you, you don't always need a doctor. You just need to be properly trained and know how to properly address a wound. Now, my name is Antonio Hogue. I am Tactically Combat Casualty Care Certified, and I'm also First Aid and AED Certified. Today, I want to explain to you how to address a wound. A cut, a laceration, anything can happen at any point in time, whether it's your child or whether it's somebody that you see on the street. So today I'm going to take you through the step-by-step process on how to dress a wound properly. Now, that first step is always going to be to assess that situation. Now, that step does not stop at that first step. You want to assess that situation throughout the entire process of dressing the wound. What I mean by assessing the situation is you want to make sure that you and the other individual are safe. Depending on what type of accident this is, you want to make sure that you're aware of your surroundings and you're doing it in a safe and controlled environment if possible. The second step is cleanliness and hygiene. The last thing that you want to do is make that infection or make that scar, wound, tissue, whatever it may be. You don't want to make that worse. So if you're able to, you need to wash your hands and you need to wear gloves. So cleanliness. The third step is to assess that situation for any supplies that might be around. Most businesses, most public areas, most places have some type of first aid or AED kit next to them. Now, I would suggest that you always carry one in the trunk of your car, but if that's not possible, you would find like item things to substitute in place for those items. Now, for this demonstration, I am going to go ahead and use some basic gauze, some basic tape, just to give a brief demonstration. So, step 4 is if it's bleeding, you want to make sure that you go ahead and apply that pressure until that bleeding stops. You will not be able to address the wound properly if it's profusely bleeding. It will soak everything, it will continue bleeding, it could continue getting dirt in it. So you want to go ahead and apply that pressure with some type of clean cloth until that bleeding stops. Now, once that bleeding stops, if it was a lot of bleeding, you want to go ahead and rinse that off gently with some clean and sterile water. Once that area is clear, you can go ahead and pat that area down with some type of clean cloth. Now, as far as applying gauze to the wound, you want to make sure that you place it firmly, but not too tight where it's cutting off any circulation at all. Again, this is a very loose demonstration, so it's not going to be very tight, but this is just showing you the step-by-step process. So once you have that in place, whatever you're using, whether it's a sock, whether it's the gauze, whether it's something that you took from your car, you want to make sure that that's in place, and then you have some type of wrap or tape to go around it. So I'm going to go ahead and apply that right here. Now, this is going to, again, help continue to stop the bleeding and help protect it from any type of infection. Now, this is a very loose and bad demonstration, but that is the step-by-step process on how to apply it, which takes me into my next step, is you want to go ahead and double check, check for any errors, check if it's bleeding through. You want to, go ahead and make sure that it's applied correctly. If it's not applied correctly, don't worry. You can always reapply it, make sure that it's tighter, make sure it's firmer, make sure you have more gauze, whatever the case may be. And you want to check for other wounds. So again, that first step, assess the situation that I said was a process throughout. You want to go ahead and make sure that you're doing that throughout the process. And that includes this step, is you want to check for other wounds, other cuts. Ask the individual, hey, are you feeling any additional pain? As you're communicating them through the whole time, you want to make sure that they feel comfortable. Their adrenaline could be spiking. They could be in shock, depending on how bad that accident was. So you want to just go ahead and make sure that you're communicating clearly with them and getting that coherent feedback if possible. If suitable, it is advised that you stay with that patient to do what I just said until that next higher level echelon of medical care arrives. Now, I get sometimes it may just be your kid who has a little boo-boo on his knee or her knee, whatever the case may be. But if you are in a situation to where you need to stay with that patient, it is advised to do so until that higher echelon of medical care arrives. Now, again, I want to reiterate that this isn't just for other people. It can be for yourself. It can be while you're going to school. It can be while you're at work. It can be while you're doing anything in life. This opportunity may come. So you may not need the doctor. It may just be a regular person with some common knowledge. I think that this is a very common skill that people should have. Accidents can happen at any time, and the last thing we want is for something small to be any bigger. So now that we've been through that, I am confident that you are able to go through a step-by-step process on how to assess a situation, address a wound, and make sure that that patient or that individual is okay. And I implore you and I challenge you to go ahead and practice on yourself. Practice at home, practice on a friend, to make sure you got a couple repetitions down, just to make sure if anything happens that you are the one prepared. Thank you.